I'll make a parallel first with other chronic disease management so that it sort of sets the stage for why we set up the team we have. So if you think about oncology treatment, if a loved one of yours unfortunately developed breast cancer and you brought them to get clinical care, you would expect that they would be seeing an oncology doctor. They probably would have a nurse practitioner or a physician assistant that works with them. For sure, there would be a nurse in the office that they meet with and who's helping to coordinate care. It's probably a navigator that helps them to set up radiation treatment or a surgical procedure or an imaging procedure. They help coordinate their care. They might also recommend that that patient participate in a breast cancer support group or that they get counseling. But in general, people don't think of the treatment that they're receiving, that the mainstay of that treatment is this counseling or the group support, that those are really it, and that all of the rest of this other treatment is optional. And that's how we're treating addiction today. We are really isolating patients to give them simply group support and counseling without any of that medical care. So I based the structure, Dr. Scheido and I based the structure of NorthStar really in an image that represents exactly what you do for other chronic disease management. We have an addiction physician that oversees the treatment of every patient. We have physician assistants and nurse practitioners. In fact, the nurse practitioners we hire are psych nurse practitioners, so they can also help assess patients' psychiatric issues and help us identify medications that could help those issues at the same time. We have nurses on the team. We have navigators on the team. So again, replicating how chronic disease management is done today. We add to that peer guides. We want our patients to be able to work with people who have lived experience with this disorder themselves and who have had this same struggle. So peer guides work with patients both individually and in groups. We have a therapist on the team who can lead psychoeducational groups where they can learn certain life skills. And then lastly, we have a psychiatrist who reviews every case with the team and goes over that. So by bringing all of these different specialists together, all of these different team members together, the patient has a comprehensive wraparound support team that can address really all of the typical issues that come up for patients who struggle with substance use.